All right, I want to ask you something. When was the last time you had your blood sugar checked? I don't mean years ago at a routine physical. I mean recently. Because there is a number that a lot of men your age are carrying around right now without having any idea, and it matters a lot more than most people realize. Here's the thing. More than half of all Americans over the age of 65 have what doctors call pre-diabetes. That means their blood sugar is running higher than it should be. Not high enough yet to be called diabetes, but heading in that direction. And here is what really gets me about that statistic. 8 out of 10 of those people have absolutely no idea. Their doctor may not have told them. They feel fine. They are just going about their lives while this thing quietly builds in the background. And today, I want to talk to you about a study that came out of Spain that I think every man over 55 should know about. Because it looked at people in exactly that situation, older adults with elevated blood sugar, and it found that adding one specific food to their diet twice a week produced results that honestly surprised the researchers themselves. That food is sardines. Canned sardines. The kind you can pick up at any grocery store for about $2 a tin. Now, I know some of you just made a face. Stick with me. Because once you understand what is actually going on inside that little can and what happened to the people in this study, I think you are going to look at it very differently. Let me start with the pre-diabetes picture, because the numbers are worth sitting with for a minute. The CDC released updated figures in January of this year, 2026, and they estimated that 115 million American adults currently have prediabetes. That is not a typo. 115 million people. And men are hit harder than women. 41% of men have prediabetes compared to 32% of women. If you are between the ages of 45 and 65, studies suggest the rate in your age group is closer to 45%. And here is why this matters beyond just a number on a lab test. Research published in The Lancet found that without making any changes, around 1 in 7 older men with prediabetes will develop full type 2 diabetes within 5 years. Diabetes brings with it a whole cascade of problems: nerve damage, kidney issues, vision problems, heart disease, a higher risk of dementia. It is not a diagnosis anyone wants. The good news, and there genuinely is good news here, is that prediabetes is not a one-way door. You can turn it around. And the study I want to tell you about today suggests that a pretty simple dietary change might be one of the most powerful tools for doing exactly that. So here is what the researchers did. They recruited 152 men and women aged 65 and older, all of whom had been diagnosed with prediabetes. They put everyone on a sensible, healthy eating plan for a year. More vegetables, less processed food, that kind of thing. Then, they split the group in half. One group just followed the healthy eating plan. The other group did the same thing, but also ate 2 servings of canned sardines in olive oil every week, roughly 100 grams each time, which is about 1 standard tin. 1 year later, they looked at who was still classified as being at very high risk of developing type 2 diabetes. In the group that only followed the healthy eating plan, that number barely moved. It went from 27% down to 22%. But in the sardine group, it dropped from 37% all the way down to 8%. 8%. That is a dramatic change from 2 tins of sardines a week on top of eating reasonably well. The sardine group also showed improvements in blood pressure, cholesterol levels, and something called insulin resistance, which is essentially a measure of how well your body is handling the sugar in your blood. All of it moved in the right direction. The lead researcher, Dr. Diana Diaz Rizzolo, put it plainly. She said sardines are reasonably priced, easy to find, safe, and actually help prevent the onset of type 2 diabetes. Her recommendation was that doctors should feel comfortable telling patients to add them during a regular checkup. So what is it about sardines specifically that is doing this? They are not just any fish. There are two things going on inside them that researchers believe are driving these results, and they work in completely different ways. The first is something most people have never heard of. It is called taurine. Before you tune out on the unfamiliar word, just give me 30 seconds, because this is actually a fascinating story. Taurine is a compound your body naturally produces, but as you get older, your levels tend to drop. It is found in animal foods, and sardines happen to be one of the richest natural sources of it in the food supply, significantly richer than regular chicken or beef. Here is what taurine does in relation to blood sugar. A major review study published in 2024, pulling together data from multiple clinical trials, found that taurine lowers fasting blood glucose levels, improves how sensitive your body is to insulin, and reduces blood pressure. It appears to work through several pathways at once. It helps the liver produce less glucose when it does not need to. It helps the pancreas, the organ that makes insulin, function better. And it helps your cells actually listen to the insulin signal when it arrives, rather than ignoring it, which is essentially what happens in insulin resistance. Think of insulin like a key and your cells like a locked door. In a healthy body, insulin turns the key and glucose flows in from the bloodstream, giving your cells energy. In insulin resistance, the lock starts to jam. The key is there, but the door barely opens. Glucose builds up in the bloodstream instead, and taurine appears to help loosen that lock back up. The second thing sardines bring to the table is something you have probably heard of: omega-3 fatty acids. Sardines are one of the most concentrated sources of omega-3 fatty acids in the entire food supply. One standard tin gives you around 2 grams, which, according to the Cleveland Clinic, is one of the highest levels of any fish you can eat. Omega-3 fatty acids work on blood sugar through a different route. They reduce inflammation throughout the body, and chronic low-grade inflammation is one of the things that makes insulin resistance worse over time. They also directly improve how well your muscles and your liver respond to insulin. When that response improves, your body needs less insulin to do the same job, and your blood sugar levels stabilize. And here is something worth knowing if you are also thinking about your heart, which at 55 or 60 most men should be. A Harvard study found that eating just 1 or 2 servings of sardines per week provides enough omega-3 fatty acids to reduce your risk of heart disease by more than 1/3. A large 2024 study tracking over 100,000 participants found that people with the highest omega-3 levels in their blood had a 17% lower risk of dying from any cause and a 21% lower risk of dying from cardiovascular disease. Heart disease and diabetes are deeply connected. They tend to travel together. So a food that addresses both at once is genuinely worth paying attention to. If you are not already subscribed, hit that button now. We cover exactly this kind of research every week, real studies explained in plain English, specifically for men over 55. It is completely free, and it takes about 2 seconds. Now I want to make sure I am being straight with you about what this study does and does not prove, because that matters. This was a randomized controlled trial, which is a stronger type of study than a lot of nutrition research. The researchers randomly assigned people to groups and actively gave them the sardines, rather than just asking people what they already ate and seeing what happened. That gives us more confidence that the sardines were actually responsible for the difference, rather than some other factor. But there are a few things to keep in mind. The study was done in Spain, where the overall diet is already fairly Mediterranean style, and perhaps somewhat closer to eating sardines than the average American diet. Whether the results translate perfectly to a man in Ohio or Texas eating a typical American diet, we cannot say for certain. The study also only looked at people who already had prediabetes and were over 65. If your blood sugar is currently normal, this study does not give direct evidence that sardines would produce the same effect. The heart health and anti-inflammatory benefits of omega-3 fatty acids still apply. Both groups in this study were following a healthy eating plan. The sardine group had sardines on top of that. This is not a comparison of sardines versus a diet of fast food and soda. It is a comparison of healthy eating with sardines versus healthy eating alone. That is an important nuance. None of that takes away from how striking the results were. But I want you to have the full picture, not just the headline. So practically speaking, what does all of this mean for you? First and most importantly, if you have not had a fasting blood glucose test in the last year, go get one. This is a simple blood test your doctor can order, and you can often get it done at a pharmacy clinic or with a basic lab order. Given the numbers we talked about earlier, that more than half of men your age potentially have prediabetes, and most of them do not know it, this is not optional information. You want to know where you stand. If your results come back in the prediabetes range, do not panic. That is actually useful information, because it means you still have time to change the trajectory. And if this study is anything to go by, adding sardines to your diet twice a week is one of the simplest things you can do. You do not need a prescription. You do not need a specialist. You need a can opener. If you have never eaten sardines or you find the taste a bit strong, there are easy ways to work them into your meals without it feeling like a challenge. Mix them into pasta with olive oil, garlic, and a little lemon, and you genuinely cannot tell you are eating what most people think of as bait. Mash them onto whole grain toast with a little mustard, or use them on top of a simple salad with some capers and onion. The bones in canned sardines are soft enough to eat. You will not notice them, and they are actually a solid source of calcium, which is another thing a lot of men over 55 are not getting enough of. If you already have a diagnosis of type 2 diabetes, or you are managing it with medication, please talk to your doctor before making significant dietary changes. Changes in what you eat can affect your blood sugar levels in ways that interact with medication, and that conversation needs to happen with someone who knows your specific situation. But if you are a generally healthy man over 55, eating a reasonably balanced diet, and you are looking for one genuinely evidence-backed addition you can make starting this week, this is about as simple and affordable as it gets. 2 tins a week, about $4. A nutrient profile that almost nothing else in your grocery store can match for the price. A clinical trial showed results that moved researchers enough to recommend it at medical checkups. Your blood sugar has probably been on autopilot for a long time. This might be one of the easiest ways to start paying it a little more attention. Thank you for watching. Stay informed, stay proactive, and we will see you in the next one.